All India Radio presents Morning News. Good morning. I'm Sunil Verma and with me is Saira Mujtaba. The headlines. Prime Minister Narendra Modi to visit Gujarat and Diu today to review the situation and damage due to Cyclone Tauktae. Prime Minister describes aggressive testing, marking local containment zones and giving correct information to the public as weapons against COVID-19. India's cumulative COVID-19 vaccination coverage exceeds 18 crore 57 lakh doses. Government says more than 20 crore 78 lakh COVID vaccine doses have been provided so far to states and union territories. Panchayati Raj Ministry gears up to prepare rural India for fight against coronavirus pandemic. In Bihar, amid lockdown, government sets up community kitchens in various places to provide food to the poor. Union government says 24% more wheat procured during current Rabi marketing season in comparison to corresponding period of last year. Government brings changes in existing customs import of goods at concessional rate of duty rules IGCR 2017 to boost trade facilitation. In tennis, 20-time Grand Slam champion Roger Federer, defeated by world's number 75 Pablo Andujar in the second round of Geneva Open, and Serena Williams crashes out of the WTA tournament in Parma. As the number of COVID cases is on the rise, we appeal to our listeners not to lower their guard and take all precautions, and all those above 44 years of age who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in details. Prime Minister Narendra Modi will visit Gujarat and Diu today to personally review the situation and damage due to Cyclone Tauktae. He will also hold a review meeting in Ahmedabad. Mr. Modi will leave Delhi at around 9:30 in the morning. He will also conduct an aerial survey of cyclone-affected areas, including Bhavnagar, Una, Diu, Jafrabad and Mahua. In Gujarat, the extremely severe cyclonic storm Tauktae, which crossed Saurashtra coast on Monday night, took 13 lives and left a trail of destruction. Quoting official sources, AIR correspondent reports that the coastal districts of Saurashtra suffered the maximum destruction following very strong winds and heavy rainfall due to the cyclonic storm.
Nearly 16,500 houses have been damaged in the cyclone-hit areas of Saurashtra. More than 40,000 trees uprooted due to very strong winds, which had also damaged the mango and coconut trees. Power outages were reported from 5,951 villages, including 52 COVID-19 hospitals and 13 oxygen plants. Nearly 70,000 electric poles have been damaged due to cyclone. Relief and restoration works are on in the cyclone-hit areas. Meanwhile, most parts of Gujarat have received moderate to heavy rainfall under the impact of cyclonic storm. More than 100 mm rainfall recorded in Ahmedabad city last evening. Yogesh Pandya, AIR News, Ahmedabad.
The weakened cyclonic storm Tauktae entered the southwestern parts of Rajasthan last night as a deep depression. A Met Department official said that the storm has become very weak. Good rainfall was recorded in Udaipur and other districts of the state last night. The Met Department has predicted good rainfall in many districts of the state for the entire day due to the impact of this system. Prime Minister Narendra Modi has described aggressive testing, marking local containment zones, and dissemination of complete and correct information to the public as weapons against the COVID-19 pandemic. The Prime Minister interacted with field officials from various states and districts yesterday to converse about the experience in handling the pandemic. Speaking on the occasion, Mr. Modi termed the district officials as field commanders and said they have ensured effective local containment strategies to mitigate the effect of the pandemic.
हमें संक्रमण को भी रोकना है और दैनिक जीवन से जुड़ी जरूरी सप्लाई को भी बेरोक टोक चलाना है। इसलिए स्थानीय स्तर पर कंटेनमेंट के लिए जो भी गाइडलाइंस जारी की उनका पालन कराते समय इस पर भी गौर करना है कि गरीब को परेशानी कम से कम हो, किसी भी नागरिक को परेशानी न हो। टीकाकरण कोविड से लड़ाई का एक सशक्त माध्यम है, इसलिए इससे जुड़े हर भ्रम को हमें मिलकर के उसको निरस्त करना। कोरोना के टीके की सप्लाई को बहुत बड़े स्तर पर बढ़ाने के निरंतर प्रयास किए जा रहे हैं।
The Prime Minister said the work of field officers, which includes building confidence among frontline workers and also acting against hoarders of drugs and medical equipment, is crucial in the fight against the pandemic. The Prime Minister said, amidst rising cases and challenges of health infrastructure in rural areas, district officials are entrusted with greater responsibility of reaching out to the people. He informed that the task of setting up of oxygen plants is being actively completed in the districts using funds allocated from PM CARES. The Prime Minister also called for setting up district monitoring cells in this regard for effectively bridging the gap between the supply and usage. Mr. Modi said, the country has undertaken the largest vaccination drive in the world.
वैक्सीनेशन के लेकर व्यवस्थाओं और प्रक्रियाओं को हेल्थ मिनिस्ट्री लगातार स्ट्रीमलाइन कर रही है। कोशिश ये है कि अगले 15 दिन का शेड्यूल राज्यों को एडवांस में मिल जाए। इससे आपको भी पता रहेगा कि जिले में कितने लोगों के लिए वैक्सीन उपलब्ध होने जा रही है और आपको किस हिसाब से तैयारी करनी है। वैक्सीन वेस्टेज रोकने में जिला स्तर पर सही प्रबंधन की भूमिका के बारे में भी आप अच्छी तरह जानते हैं। आपके सहयोग से वैक्सीन वेस्टेज पूरी तरह रुक सकती है।
The Union Health Ministry has said there is a continuous decline in the number of active cases of COVID-19. It said further improvement in cases of recovery is also being noted in the country over the last 15 days. Briefing media in New Delhi, Joint Secretary in the Health Ministry, Love Agrawal, informed that the number of active cases has now come down to 13.3%. He also informed that the country has reported its highest ever recovery of over 4,22,000 patients in the last 24 hours.
3 मई को जहां यह 17.13% था, वह घटते घटते अब केसेस जो हमारी मेडिकल सुपरविजन में हैं, वह 13.3% हो चुके हैं। इसी तरह से हम एक रिकवरी में भी पॉजिटिव ट्रेंड नोट कर रहे हैं। 3 मई को जहां पर देश में रिकवरी ऑन एन एवरेज 81.7% थी, वह बढ़ते बढ़ते अब 85.6% हो गई है। जितने केसेस देश में पिछले 24 घंटे में रिकवरी की कैटेगरी में आए हैं, वह है 4,22,436, जो कि देश में अब तक की हाईएस्ट रिकवरी है।
India has administered more than 18 crore 57 lakh doses of COVID-19 vaccine in the country so far. These include over 96 lakh 73,000 healthcare workers who've taken the first dose and more than 66 lakh 58,000 healthcare workers who've taken the second dose. Over 1 crore 45 lakh frontline workers have taken the first dose and more than 82 lakh frontline workers have taken the second dose. The ministry said more than 5 crore 48 lakh people above 60 years have taken the first dose and more than 1 crore 79 lakh citizens have taken the second dose. The health ministry said that more than 12 lakh 79,000 beneficiaries were inoculated with COVID-19 vaccine doses till yesterday. Out of these, more than 10 lakh 96,000 beneficiaries were vaccinated with the first dose and more than 1 lakh 83,000 beneficiaries received the second dose. The ministry said more than 5 lakh 14,000 beneficiaries in the age group of 18 to 44 years received their first dose of COVID vaccine and cumulatively over 64 lakh 60,000 across 36 states and union territories. The liberalized and accelerated Phase 3 strategy of COVID-19 vaccination came into force from the 1st of this month.
The government has said that more than 20 crore 78 lakh COVID vaccine doses have been provided so far to states and union territories. The Union Health Ministry said as part of the nationwide vaccination drive, the government has been supporting the states and union territories by providing them COVID vaccines free of cost. The ministry said more than 1 crore 94 lakh COVID vaccine doses are still available with the states and union territories to be administered. It said 1 lakh vaccine doses are in the pipeline and will be received by the states and union territories within the next 3 days. In the second quarter of this month, from 18th to 31st of May, 1 crore 95 lakh doses will be made available free of cost by the union government. The ministry said this information has already been shared with states and union territories. In addition, more than 72 lakh doses will be available for direct procurement by the states and union territories. The Panchayati Raj Ministry has geared up to address vulnerabilities of rural India in combating COVID-19 pandemic and issued an advisory for panchayats. It has asked panchayats to undertake an intensive communication campaign for the awareness of rural communities on the nature of the COVID infection and preventive and mitigation measures. The advisory asked to provide people suitable facilities with necessary protective equipment like finger oximeters, N95 masks, infrared thermal scanning instruments and sanitizers. They've also been directed to display the information on availability of testing, vaccination centers, doctors and hospital beds on real-time basis to facilitate effective utilization of available infrastructure by the rural citizens.
Gujarat has recorded 6,447 new cases of COVID-19 yesterday. According to the State Health Department, 9,557 patients recovered during the last 24 hours and were discharged from the hospitals. More from our Ahmedabad correspondent.
Total 6,60,000 patients have been recovered from COVID-19 in Gujarat till now. The recovery rate further improved and reached up to 86.20%. Maximum 1,862 new cases of COVID-19 reported from Ahmedabad. Vadodara recorded 442 new cases, while Surat recorded 322 new cases. 67 patients lost their lives yesterday. The vaccination drive in the state has been suspended following the threat of cyclonic storm. Yogesh Pandya, AIR News, Ahmedabad.
In Chhattisgarh, the state government has decided to encourage the production of materials needed to control the corona infection. The decision was taken during a meeting of the state cabinet chaired by Chief Minister Bhupesh Baghel yesterday. More from our Raipur correspondent.
In Chhattisgarh, the Health Department has given instructions for microbiological surveillance in all government and private hospitals of the state. Cases of some other type of infections have been reported in patients admitted for treatment of COVID-19 in hospitals. In view of this, the Health Department has given instructions to ensure microbiological surveillance of all the hospitals and send its report to the State Surveillance Unit every week. Apart from this, in view of increasing cases of black fungus infection in Chhattisgarh, the State Food and Drug Control Department has instructed all the wholesale drug dealers to inform the department about the distribution of the drug posaconazole and amphotericin B used in black fungus treatment. Vikalp Shukla, AIR News, Raipur.
Tamil Nadu registered more than 33,000 fresh COVID cases yesterday. The Health Department has said that more than 2,42,000 people are hospitalized. Over 1,60,000 samples were tested yesterday. Chennai's COVID count has considerably reduced after stricter lockdown measures were imposed. The police department has asked people to register for e-passes if they have to travel to the next area within the city. Since the outbreak of the second wave of COVID-19, Karnataka has reported an improvement in the situation as recoveries surpass new COVID-positive cases. The health bulletin issued by the Health Department reports that 58,395 COVID-positive patients were discharged after recovery yesterday, which is more than 30,309 new COVID cases reported. There were 525 deaths due to COVID infection yesterday. The positivity rate remains at 32.5% and the fatality rate stands at 1.73%. The state conducted 93,247 tests yesterday. Over 1,13,48,000 persons have been vaccinated in the state. More from our Bengaluru correspondent.
The State Health and Medical Education Minister Dr. K. Sudhakar has said that Karnataka leads in establishing health and wellness centers under Ayushman Bharat program to provide comprehensive primary health care in rural areas. Union government had set a target of establishing 2,263 health and wellness sub-centers. State has upgraded 3,300 centers till March 31st. It is 146% more than the set target. A total of 4,653 health and wellness centers have to to be established in the state as given by the center, out of which 5,832 have been established, which is 125% more than the given target. Sudhindra, AIR News, Bengaluru.
In Himachal Pradesh, the state government has decided to increase the bed capacity in the existing hospitals, requisition private hospitals, and also to construct makeshift hospitals to ensure timely treatment of COVID-19 patients. Our Shimla correspondent has filed this report.
In Himachal Pradesh, COVID infection have been hitting record high for the past few days and the death toll has been on the rise. The state has registered a record 78 deaths in the past 24 hours. Of these, 23 COVID deaths have been reported from Hamirpur district alone. However, daily new COVID cases have been dropped to below 3,000 marks since yesterday. On the other hand, to meet our rising demand of COVID beds in the state, Chief Minister Jairam Thakur dedicated a 200 capacity fully oxygenated COVID makeshift hospital at Radha Swami Satsang Khaliar in Mandi district yesterday. Similar hospital is also being constructed at Neer Chowk. Meanwhile, government has decided to requisition private hospitals both within and outside the state for ensuring that COVID patients receive timely treatment. Sanjeev Sundaryal, AIR News, Shimla.
You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi to visit Gujarat and Diu today to review the situation and damage due to Cyclone Tauktae. Prime Minister describes aggressive testing, marking local containment zones and giving correct information to the public as weapons against COVID-19. India's cumulative COVID-19 vaccination coverage exceeds 18 crore 57 lakh doses. Government says more than 20 crore 78 lakh COVID vaccine doses have been provided so far to states and union territories. Panchayati Raj Ministry gears up to prepare rural India for fight against coronavirus pandemic. In Bihar, amid lockdown, government sets up community kitchens in various places to provide food to the poor. Union government says 24% more wheat procured during current Rabi marketing season in comparison to corresponding period last year. Government brings changes in existing customs, import of goods at concessional rate of duty rules IGCR 2017 to boost trade facilitation. And in tennis, 20-time Grand Slam champion Roger Federer defeated by world number 75 Pablo Andujar in the second round of Geneva Open. And Serena Williams crashes out of the WTA tournament in Parma. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
In Bihar, amid lockdown, the government has set up community kitchens in various places to provide food to the poor. Chief Minister Nitish Kumar has given instructions to set up community kitchens at every block of the state so that maximum people get the benefits. Mr. Kumar said the state government is taking all necessary steps to protect the life of the people infected by COVID-19.
राज्य के सभी 38 जिलों में 432 सामुदायिक किचन चलाए जा रहे हैं। हमने सामुदायिक किचन को विस्तारित करते हुए हर प्रखंड में सामुदायिक किचन खोलने का निर्देश दिया है ताकि अधिक से अधिक जरूरतमंद इसका लाभ उठा सके। सरकार की मंशा है कि लॉकडाउन में मजदूर, निर्धन, निराश्रित, निःशक्त एवं जरूरतमंदों को दोनों वक्त शुद्ध भोजन मिले एवं कोई भूखा न रहे। सभी सरकारी अस्पतालों में रोगियों के परिजनों के लिए भी सामुदायिक किचन के माध्यम से भोजन उपलब्ध कराया जा रहा है।
In Odisha, the statewide lockdown has entered the second phase from today. The entire state is in lockdown since the 5th of this month. That will now continue till the 1st of June with complete weekend shutdown in between. More from our Bhubaneswar correspondent.
This phase of the lockdown has come up with more stringent curbs on the movement of people across the state. While people can now avail only a 4-hour window to purchase essential items from 7 a.m. till 11 a.m. on all weekdays, marriage functions would be restricted to a maximum of 25 persons, with funerals having a cap of 20 participants only. Meanwhile, the state government has said that COVID-19 infection, having already peaked on the 13th of this month, is now on the wane, with the rate of positivity sliding down from 21% last week to 18% now. Girish Chandradas, AIR News, Bhubaneswar.
The union government has said that 24% more wheat has been procured during the current Rabi marketing season 2021-22 in comparison to the corresponding period last year. The Ministry of Consumer Affairs, Food and Public Distribution in a statement said that over 373.51 lakh tons of wheat has been procured against the corresponding purchase of over 300 lakh tons last year. It said nearly 38,22,000 farmers have already benefited from the procurement operations with MSP value of over 73,768 crore rupees. It said procurement of wheat in Rabi marketing season is continuing smoothly in the procuring states, including Uttar Pradesh, Madhya Pradesh, Bihar, Rajasthan and Himachal Pradesh. The Union Government has brought changes in the existing customs import of goods at concessional rate of duty rules IGCR 2017 to boost trade facilitation. The Central Board of Indirect Taxes and Customs has introduced changes through the Customs Import of Goods at Concessional Rate of Duty Amendment Rules 2021. IGCR 2017 laid down the procedures and manner in which an importer can avail the benefit of a concessional customs duty on import of goods required for domestic production of goods or providing services. The Ministry of Finance in a statement said that one major change that accommodates the needs of trade and industry is that the imported goods have been permitted to be sent out for work.
Noida Traffic Police, along with Fortis Hospital, has launched 20 auto ambulances in the city. Anyone can avail the service by calling on Traffic Police helpline number 997-100-9001. Talking to All India Radio News, DCP Noida Traffic Police Ganesh Prasad Saha informed that every ambulance is equipped with oxygen cylinders to facilitate the movement of patients. In Ladakh, the flagship scheme Mahatma Gandhi National Rural Employment Guarantee Act (MGNREGA) has emerged as a source of employment in the sparsely populated villages. The people are using this scheme for community asset creation. On the occasion of 50 years of AIR Leh, our correspondent has filed this report.
People are not just taking the benefits of hand-dressed job for their livelihood, but also using MGNREGA for creation of agricultural and horticultural assets in their villages. Among the 27 admissible sectors, land development has been one of the most preferred sectors for many Gram Sabhas of the Union Territory. Job card holders of Sabu Panchayat in Leh block have now reclaimed agricultural landfill debris of the 2010 and 2015 floods. Similarly, in Phyang Panchayat as well, MGNREGA job card holders have developed uncultivable barren land into apple orchard. For the barren land development, additional water bodies for irrigation by channeling water from a nearby stream were created under the MGNREGA. A 20-canal area of orchard is developed with the support of Horticulture Department. Block Development Officer Leh Thiring Angchuk talks about MGNREGA implementation in Leh block.
ब्लॉक को ले की बात करें तो
If we talk about Leh block, there are 7 Halka Panchayat. MGNREGA is successfully implementing in every Panchayat of the block. Land development, especially in Sabu, Phyang, Spituk, Choglamsir and Halka Farka are going smoothly.
बहुत अच्छी तरह से करवाते हैं.
With Ramesh Chandra, Jangchan Dolma for Air News from Leh Ladakh.
Railways has delivered more than 11,330 tons of liquid medical oxygen so far to 13 states. Railways is continuing its journey of bringing relief by delivering liquid medical oxygen to various states across the country. The Railway Ministry said nearly 175 oxygen expresses have completed their journey so far and brought relief to various states.
And now on to sports. In tennis, 20-time Grand Slam champion Roger Federer was handed a shock defeat by world number 75, Pablo Andujar, in the second round of Geneva Open. Spaniard Andujar defeated top-seeded Federer 6-4, 4-6, 6-4. Notably, the match was 39-year-old Federer's first since March this year, and the tournament was his second in past 15 months. With this defeat, Federer's 32-match winning streak on his Swiss soil ends. Sixth-seeded Fabio Fognini of Italy beat Argentina's Guido Pella 6-2, 6-2. Meanwhile, former world number 1 Serena Williams crashed out of the WTA tournament in Parma when she lost in straight sets 7-6, 6-2 to 68th ranked Czech Katerina Siniakova in the second round today. Former US Open champion Sloane Stephens reached the quarterfinals after rallying to beat fourth-seeded Daria Kasatkina 1-6, 6-4, 7-5. Third-seeded Coco Gauff eliminated Kaya Kanepi 7-6, 6, 7-6, 7 in a first-round match. Second-seeded Petra Martic also got her Parma campaign off to a good start by beating Varvara Gracheva 6-4, 6-2.
Talking to All India Radio, Director of All India Institute of Ayurveda, Professor Dr. Tanuja Manoj Nisari has said that patients who are asymptomatic and those with mild to moderate COVID-19 symptoms can take the polyherbal drug Ayush 64.
आयुष 64 जो संशोधन में ये पाया गया है कि जो 500 मिलीग्राम की जो गोली 250 मिलीग्राम या 500 मिलीग्राम की गोली जिनको माइल्ड लक्षण है जो पॉजिटिव है और सिम्टोमेटिक है या जिनके माइल्ड लक्षण है उनको सुबह और शाम ऐसे 500 मिलीग्राम टू 1 ग्राम तक सुबह शाम ले सकते हैं। जिनको बुखार है, बॉडी एक है, थोड़े और लक्षण है, वो 2 गोली 3 बार उनको लेने चाहिए। और ये लगातार जब पॉजिटिव है और लक्षण है, लक्षण कम भी हुए तो अगर 20 दिन लेंगे तो ये कंप्लीट रिकवरी हो जाती है।
And now let us take a look at the weather forecast for the day. The national capital Delhi is likely to have a generally cloudy sky with heavy rain. The temperature will hover between 23 and 30 degrees Celsius. Mumbai will have a generally cloudy sky with light rain or drizzle. The minimum temperature was 25 degrees Celsius, while the maximum is expected to be around 30 degrees. Chennai will see a generally cloudy sky with light rain or drizzle. The temperature will vary between 29 and 34 degrees Celsius. Kolkata will have a partly cloudy sky. The minimum temperature was 30 degrees Celsius and the maximum will go up to 39. Jammu will have a partly cloudy sky with the possibility of rain or thunderstorm or dust storm. The minimum temperature was 23 degrees Celsius while the maximum will be around 38 degrees. Srinagar will have a mainly clear sky becoming partly cloudy towards afternoon or evening. The temperature will hover between 12 and 25 degrees Celsius. Leh is expected to have a mainly clear sky, while the minimum and maximum temperatures will vary between 3 and 18 degrees Celsius. Gilgit will have a partly cloudy sky. The temperature will hover between 15 and 27 degrees Celsius. Muzaffarabad is also likely to have a partly cloudy sky with the possibility of rain or thunderstorm or dust storm. The minimum temperature was 17 degrees Celsius and the maximum will be around 34 degrees. And Dehradun will have a generally cloudy sky with heavy rain. The minimum temperature was 19 degrees and the maximum will be around 31 degrees Celsius.
And now an overview of today's newspapers. On Cyclone Tauktae, the Business Standard reports over 300 rescued from barges that went adrift. A glimmer. Positivity declines, new cases down in 200 districts is the headline in the Indian Express. Business Standard quotes the Prime Minister as assuring field officials from states and districts that continuous efforts were on to increase the supply of coronavirus vaccine. Data shows that India's virus hotspots are on the road to recovery, writes Hindustan Times. The paper also mentions on its front page that India recorded 4,522 deaths yesterday, the most in one day for any country. Recoveries go up 4% in 2 weeks, writes the Tribune. And finally, Covaxin trials for kids to start in 10 to 12 days, says government, reports Hindustan Times.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi to visit Gujarat and Diu today to review the situation and damage due to Cyclone Tauktae. Prime Minister describes aggressive testing, marking local containment zones and giving correct information to the public as weapons against COVID-19. India's cumulative COVID-19 vaccination coverage exceeds 18 crore 57 lakh doses. Government says more than 20 crore 78 lakh COVID vaccine doses have been provided so far to states and union territories. Panchayati Raj Ministry gears up to prepare rural India for fight against coronavirus pandemic. In Bihar, amid lockdown, government sets up community kitchens in various places to provide food to the poor. Union government says 24% more wheat procured during current Rabi marketing season in comparison to corresponding period of last year. Government brings changes in existing customs import of goods at concessional rate of duty rules IGCR 2017 to boost trade facilitation. In tennis, 20-time Grand Slam champion Roger Federer defeated by world number 75 Pablo Andujar in the second round of Geneva Open. And Serena Williams crashes out at the WTA tournament in Parma. And with that, we end the morning news. Have a nice day.